Here it is.
Thank you.
Sure. All right, let me get my PowerPoint to the beginning and we'll start from there. So housing options for individuals with disabilities. So first I want to start with housing planning. It's not much different than any other planning that you're doing. So setting up where you want to be and then working backwards in what it's going to take to get there. Some people, as you all have heard, may receive or are already receiving a Medicaid waiver. In order to be eligible for that, you have to meet the criteria for county board services. There is a waiting list for waivers through the state, and for all information with that, you can contact your local county board. I'm not sure in the audience how many people are connected to the county board, but in this presentation, I'm also going to talk about affordable options or affordable housing options for those of you that are not connected to the county board. I want to be clear up front and try to simplify. Waivers do not fund housing, so they don't fund the physical structure. They don't pay rent, first month's rent, or anything like that. But what waivers do is provide the supports and services needed for the individual in housing or in residential. Those things can include staff support, technology supports, day supports, transportation. So just keep that in mind as we work through this. And simply waivers, again, don't pay for physical structure of housing, but they do support the services that an individual may need residentially. For housing planning, rent and utilities must be paid from other sources. So that means your earned income. If the individual has a job, just like all of us, and they're receiving a paycheck, they can pay rent out of that. Social Security can also go towards rent. I'll talk a little bit about that. And really, if you're talking about Social Security and the individual receives that benefit, my best advice would be to talk to someone about benefits, because there is a little bit of a difference. Social Security can cover rent, and should not affect your Social Security check or benefit. However, if somebody else is supplementing that rent, like a parent or somebody, it can be considered in-kind services, and that may affect benefit. So again, my best advice when it comes to Social Security paying for housing options is to talk to a benefits counselor, or if you have already some sort of advisor, they can help you through that. So there's two pieces to housing planning. First, your physical housing, and then supports to live in that housing. So today I want to talk about just planning for physical housing. I've talked to the Autism Society, and there's so many moving parts and pieces to services and access to services that we have some future planning in the works to go over all the separate pieces to try to break it down a little more simplified for you. But tonight I do want to talk about physical housing. And when we talk about supports to live in that housing, at a future date, it really comes down to the individual. I know a lot of people have specific questions, and that really does come from planning and defining or what needs of that individual are. So physical housing. First, when you talk about physical housing, you want to talk about what do home and community mean to your family member. So home and community, when we all think of home or our community, we think about where we want to live. What type of living do we want? For your individual or family member, are you thinking about them living independently in an apartment by themselves? Or do you think that they may need a little more support, or they want a roommate? Do I want roommates? Where would I like to live? As we're all thinking about housing planning, typically we think about, do we want to live in a city, an urban area? Do we want access to the services in a city? Or do we want to live rurally, out in the country, maybe a little bit more land? Do we want to live in an apartment, a high rise? If your family member needs, accessible housing, then a high rise probably isn't going to work. Also, a lot to think about is access to public transportation. So when individuals are looking for housing and they may not drive, then is it important to be near a bus stop? typically, and I can speak to Summit County, you find more bus stops in Akron Central, and then they get less and less moving out from Akron. But we do a lot of work with people and really thinking about that, and do you need access to public transportation, and trying to find, you know, that physical housing close to a bus stop or accessible to that. You want to think about walkability. If the person doesn't drive, are they able to walk to go, you know, get milk? Can they walk to social events? Is that important to them? So is where they're living walkable? A lot of times neighborhoods don't have sidewalks. So that's important to remember too, just in my experience with people. You know, someone may, I had somebody who lived at the University of Akron. They were a college student there. They really liked it there and wanted to move back. However, they needed accessible housing. They didn't drive, so they needed public transportation. So it was really working out, is that the best fit for you and where you want to be? Is that where you want to call home, or where you want to be a part of that community? So now I'm going to talk a little bit about types of housing. These are just some of the terms that come up when you start housing planning, especially if you're working with a county board. First is congregate or group home. These are just group homes. Congregate just means several people in a living arrangement. So you can have up to 4 individuals living in the same home. The rent and utilities in that space are divided equally among the 4 people who live there. Each individual also, and very important to remember when you get into a congregate setting, is they should have their own lease. When we talk about leases and residential arrangements, the individual themselves, it's extremely important that they have their own lease. And that lease is between them and the property owner or the landlord, that there isn't a third party that's signing that. There are some exceptions when it comes to guardianship, and what type of guardianship that you have, but really the individual should be the one on the lease, not any different than any of us and any other residential arrangement that we have. In a congregate or group home setting, if you're connected to the county board, you've assessed need and what type of supports that your family member needs. Congregate may work really, really well for them, where they have 4 individuals that have individuals who might have the same type of needs, and they're working with a provider that's typically in that home. Typically supports in that home are 24 hours. And next we'll talk about what that looks like if your family member doesn't need 24-hour supports. Shared living is another term. If you're connected to the county board, it previously was called adult foster care. What shared living is an individual with a disability gets the support they need while living with a paid caregiver. So thinking about shared living, this is really similar to a foster care situation. The individual lives within someone's home who is also the paid caregiver or service provider. So instead of it being a congregate setting or a group home where you have 4 individuals with a provider that comes in, the homeowner typically is the provider in a shared living arrangement. This works a lot of time for individuals whose needs are that kind of 24-hour, but they may not do well with several people in a home, or they have a relationship and they've met a provider that's willing to do that. Another type of housing that we talk about is independent living with drop-in supports. Independent living is where an individual with a disability has drop-in supports based on need. So if when planning for housing and working with your family member, they want to live in an apartment setting or have a house on their own, and they don't need somebody there overnight. They may need help with grocery shopping or getting them to and from work, help reminding them with house or apartment cleaning activities, doing laundry. All of this is determined from a team level, again, if you're working with the county board, to assess what needs are, and the person is pretty independent and they just need a little bit of help in other areas. So, you know, once you've established that apartment or that home where the individual is living, then you can start to assess what type of needs and how many hours of service that they might need. This can take place again in an apartment or a house, and the individual has their own lease. So housing search. Typically when we work with people who want to live on their own or are looking at finding a place to live, I think a lot of times it's kind of misunderstood that county boards have housing. We do not have housing. We don't have houses. We don't have apartments. So when we assist people in searching for a home, we go to the same places you would, apartments.com, classifieds. We do work really hard at relationships with property management companies as well as local landlords, so that if we have people who are looking for a place to live, we can make that connection. But when you really start the housing search, it's looking right now online is probably the best place. But looking at websites and looking in classifieds and when going back to that, you know, community and home, making sure that you look where you need, where you've decided you want to live. Next, I want to talk a little bit about affordable housing. If an individual or your family member doesn't have a job or they're just receiving SSI, there are affordable housing options. Unfortunately, it's not a lot. It's always a struggle with affordable housing, but there is some. I can speak to Summit County across Summit County. I know people are here from different counties, but looking at your county housing authorities or even just, you know, typing in affordable housing Medina County, a lot of websites pop up. So affordable housing is defined as housing that can be paid for while having money left over for other necessities. It's dependent on income. Defined by the federal government as no more than 30% of income. So the federal government has said that if you have $100, say, your rent, in order to be affordable, should not be over 30% of that, so $30 a month. Again, affordable housing is a little tough to find. However, most counties do have some property management companies that offer affordable housing. So these can be low-income apartment communities. Typically, and any one of us, you don't have to be connected to your local housing authority for affordable housing. You just have to meet the income requirements. So if you find a place, it's usually on a sliding scale, your rent based on your income. Typically these places, and when people are searching for affordable housing, there is a wait list. Some of those places, the wait list turns over quite quickly. Somebody may have been on it, come to the top and already found housing, but there typically is a wait list for these communities. An application is also required, just as any other tenant. For access to affordable housing, there's a link in the PowerPoint, Affordable Housing Online. It is a national link, but you just type in your county in Ohio and it pops up as to where some of these communities are. Subsidized housing. I know a lot of people hear about vouchers, or in Summit County, it's AMHA. In Medina County, you have a different housing authority, just as in Portage County. But this is subsidized housing and is project-based housing where your funding comes from HUD, Housing and Urban Development out of the federal government. There's two different types of subsidized housing when you work with a housing authority. First, there's project-based housing. This is where the rent subsidy stays with the building. What that means is when you think of your AMHA or your county housing authority or metropolitan housing authority, you think about the high rises that are maybe around the county, or, you know, they have some smaller apartment clusters. This is project-based. So typically, if you go to your housing authority and get on a wait list, the project-based housing isn't as long of a wait for, is what I'm going to talk about next. But it's important to remember with housing authorities that they do have two different types of subsidized housing. And if you leave a unit, if you are eligible and you're able to get a unit in one of the high rises or apartment complexes, and you decide to move out, then you don't get to take that rent subsidy with you. It stays with the unit. Most subsidized housing also offer different project-based housing. One can be senior housing, another is accessible housing. So if your family member needs to have accessible housing, you can typically put yourself on a wait list for those different types of properties. A lot of times we run into a subsidized housing, the second type, which is vouchers. It was prior to probably about 2 or 3 years ago, this was called Section 8. It is now changed, and it's called the Housing Choice Voucher Program, or HCVP. In order to be eligible, you have to be 18 years old. And then HUD establishes the income limits for vouchers, just as they do in the project-based. You apply through your local housing authority. And again, most local housing authorities have wait lists. The wait list for a voucher is based on preferences. So it's a point system, a preference point system. When you apply, you automatically get a point for living in that county. And then you get several different points based on needs. If you are currently rent burdened, if you are at risk of homelessness, then you can get more preference points. Once you're placed on that wait list, it does take some time to move through. Vouchers take quite a bit longer. And I can speak to Summit County, but Summit County for a voucher, the wait time right now, because they have so many thousands of people on the list, can be anywhere from 18 months to 3 years. So it is quite a long process, unless you do have some more preference points. We've had people that have applied for a voucher and gotten it as quickly as 90 days. And then we have people who are still sitting on a wait list because they aren't at risk of homelessness or rent burdened at that particular time. So the Housing Choice Voucher Program. This is where the rent subsidy moves with the individual. If you get a voucher, you don't live in one of the high rises or apartment complexes that people associate with public housing. So you can find a house in the community, you can find an apartment in the community if you have a voucher, but the landlord has to accept the voucher. So a lot of times that's upfront. You'll know when you're looking at the affordable housing website if that landlord will accept a voucher, because a landlord who accepts a voucher has to go through a program with their local housing authority. If you have a voucher, then it is HUD requirements that it meets certain safety criteria, and the housing authority has to come out and inspect the property. And then they inspect the property every year after. It's usually a 1-year lease if you get a voucher. If something occurs and you can't live there anymore and you move out, then you can take the voucher with you and move to another place that accepts it. So it's a little bit different. You can move from place to place with a voucher. But again, the landlord or the property management company has to accept that voucher and then go through the inspection process. Every year, if you do get a voucher, you have to go through turning in all of your financial documentation on a yearly basis and just be reassessed that you still are eligible for a voucher. But most housing authorities do a really good job at giving you the timeline and what's needed to go through that. Again, this is the wait list, and vouchers, unfortunately, do take a bit longer than project-based housing through your local housing authority. Oh, I'm going to stop sharing my screen Again, as I said, this was just an overview of some of the terms you might hear. I did get a list of questions that you guys had submitted before the presentation. So let me look at the chat and see if I can go through some of these. So we're in Ohio. I wasn't sure with that. Can you speak to programs that assist with house utilities or rent for individuals in different house settings or food services? So programs that assist with house utilities or rent for individuals in different house settings. Right now, due to COVID, there's a large program that is with your community action councils that offers rent assistance. That was given through the CARES Act to each state to distribute out across their state. Other rental assistance that you can access, and the agency that comes to mind that sometimes people have really good luck with is United Way and their 211 program. They can help connect you. A lot of nonprofit organizations or churches might have that individually to assist with rent, but for the most part, when it comes to affordable housing, you're looking at the property management companies that work on that sliding scale for rental assistance. Or food services. So food services, Meals on Wheels. In Summit County, we have Mom's Meals. Again, United Way can help connect you, or if you're connected to the county board, they have a list of agencies that offer drop-in food services. We've actually done a lot lately when it comes to food and helping people access DoorDash and using some of the new food services available in delivery. But food services also, local hospitals can help connect you to, your mom's meals or Meals on Wheels services. Second question, can you talk about technology that could be used to help the individual more in their home? So technology is a really big area right now, and it's really exciting. We, even in our own homes, I don't know how many of you use Nest cams or Ring doorbells, but we're starting to set people up with disabilities and utilizing that type of technology. Over the years, it has become more and more affordable. There is a service through the county board, if you're eligible for this type of support, called remote monitoring. And remote monitoring is where an assessment is done in the home, and then the remote company starts to work on what type of technology you would need. So there are things out there that are super exciting, like something you can put on your stove to where if it stays on for too long, it will shut itself off. There's also electronic pill minders. So what those do is they have a code, and people are putting them into their, Apple Watches or smartphones, and they pop open at the time that you need to take those meds. That you can work with nursing about, and a remote monitoring company. For people who are worried about safety, or, you have your family member who's living on their own, it can be all tied in so you can have that access as well, to where it'll alert you if a door is open. They may put technology in the home to where it's a touch base, where maybe it's an iPad that's used, that when the person gets home from work, they can click on a button and they have somebody there that's, talking to them if they need anything. So there's some really exciting things with technology that people are getting put in their houses. Again, it's based on individual need and the assessment of what do they need. We do have, and if you go to the DODD website and type in remote monitoring, there's some really good videos there that show people who have gone from having, in-person, in-home supports to living completely independently just with technology. So I think there's some counties as well, it might be Cuyahoga County, that has like a demo home that you can see what types of technology can be used. I hope that answered your question a little bit. When you get into technology, again, it really is that assessment or working with a tech company to give the suggestion or to give what options are available to help that person be as independent as possible. Does a account affect housing vouchers? Interesting question with stable accounts. And I'm hoping as we develop our list of little snippets about all these things that we do something with stable accounts. You can pay rent out of stable account. And as far as I know, a stable account is tax free. So I would think that it would work the same as SSI. I don't want to misspeak. Typically, we have a benefits counselor talk about stable accounts. But if your SSI is going into a stable account or your earned income is going in and it's paying 100% for rent and not, only paying part because somebody else is supplementing, then I would not think it would affect your SSI. But again, the SSI website, and hopefully that's a really good question that I can also ask of a benefits counselor. You mentioned you will be doing a webinar on the support services available with the waiver. Do you know when? I don't know when. I'm hoping soon, because there's a lot of support services out there. And also about, just county board and how you access the county board. And then I would really like, in talking to Wendy and the Autism Society, I know people have a lot of questions that if you're not connected to the county board. So I'd really like to be a part of putting that together too, of where you can go. But I hope soon. I mean, we'll talk about when we can get that up. Does anybody else have any questions? Wendy, can you think of anything that we discussed that about residential, or questions that you have that pop up?
I know that we wanted to make it very explicit that every county is different.
Yes.
And somebody from Summit who is connected to DD can't move their child into Tuscarawas County and
Yes.
assume that the rules and the income limits and the waivers and the vouchers are the same.
Yeah.
So you have to be very familiar with the county you're living in.
Mm-hmm. Yeah, and I can speak to that. So Summit County, we are the 4th largest county in the state. So, compared to a more rural county, a rural county might serve, 500 people, and we serve over 4,200 adults and children. So it is very, very different. And in Ohio, and especially for families, I'm sure it gets very confusing because, you could live in Cuyahoga County, right on the border of Summit County, and your family member wants to live across the street, which happens to be Sagamore, and that's a Summit County. So it does those situations do get a little confusing when you are on those county borders, because the counties do operate differently. But yes, very, very good point. Each county is different. Each county has different providers. Counties have different programs. So, and just different ways that they work. So it's really important, if you are connected to a county board, to know that county.
Right.
Oh, here's some more questions. Can you list home options that are not connected to county board, thinking of ASD and individuals looking for house supports but don't have a waiver?
That's another webinar.
Yeah. Unfortunately.
And we'll be in the process of organizing that, because we realize that there's those who've been DD eligible all these years and those who haven't. And it's a whole different set of rules. So.
Yes. Where am I at? Do they have to be in housing to inquire about the waiver and support services, or are they available if the person with disability still lives at home? I'm in Summit County. So yes, if you want to get connected to the county board, the person can still be living at home. You don't have to be living on your own or in subsidized housing or with AMHA to connect with the county board. So if you're in Summit County and you have not yet connected to Summit County, you can go to summitdd.org, and it will walk you through the process and give you the contacts that you need to connect with our intake department.
Mr. Tidro, I will send you a link in an email tomorrow from the Ohio Mental Health and Addiction Board that gives you a whole layout, how to open up a private group home and all of the certifications and licensures and legal loopholes and everything. So if you go to wendy@autismakron.org, give me your email and I'll send that to you tomorrow.
And then Wendy, also, I will send a link to you to share as well to how you become a DODD agency provider. So too, as Wendy said, that's the Department of Mental Health, and then you can also be a provider through the Department of Developmental Disabilities in Ohio. So I'll make a note to send that link and you can share that as well. Do you ever find parents of different families pairing up to purchase a home for their children to reside in together with house supports? If so, are the homes considered HCVP? So yes, the answer to your first question, there are groups of parents that do get together and maybe purchase a home. Again, my best advice to you is please talk to a financial advisor or a benefits analysis. I think sometimes where the confusion lies in this is parents will get together, and if they're connected to the county board, you know, does the county board have the house? And no, we do not have that housing. However, there are parents that have done that, and it's all based on how you want to set up, you know, who's going to be the landlord of record in that home, and talking with legal advice about how you set that up. There have been people who have put a home like that in a trust, and that has a whole bunch of different legal workings. So yes, we have had that happen together, but the most important takeaway is it would be up to the parents and the families to find the home and purchase the home. There is not funding through the county board to do that. Are the homes considered HCVP? That's going to be a decision for you as the homeowner, the landlord in that home, if you're going to be a landlord of record, have leases with everybody, which you should have in place, and are you going to be willing to work with your local housing authority to accept a voucher? Are there facilities other than group homes that have 24-hour care? Yes, there are. These are called your ICFMRs, intermediate care facilities. And they are through a different funding stream at the county board. I think they're straight Medicaid, but there are other facilities. These are larger facilities though that are ICFs. Again, if you're connected to an SSA, that's definitely something that you can talk about. Typically when you get into ICFs, you're looking at individuals who need more medical supports in those settings, but there are other available options. We do have some people though, and just based on their individual position, that, you know, it's two people that live in an apartment that do have 24-hour support. It's all how you set that up and what support and needs are considered for your family member. Karen, there's so much information to digest. Yes, there absolutely is. And after 25 years, I still do not have it all. And unfortunately, it changes too. It changes a lot. So I absolutely sympathize with family members trying to listen to all of this. And this is just basic residential stuff. And then on top of it, there's so many other things. So our job is hopefully to simplify for you and work with you on an individual basis. And as parents, for questions that you do have, I would say contact your local county board. If your child is still a student in school, then schools have access to resources that they can maybe point you in that direction. I know a lot of families find a lot of information out amongst family members or places like the Autism Society, Ocali. So there's a lot of different organizations that are out there to help with questions that you have. Does anybody else have any other questions? These were all good ones. And I know there's a lot more questions, but we'll, and you're absolutely welcome, Star.
Any,
Um,
any more questions?
oh, what is Ocali? So I don't know if I would quite do Ocali justice, but stars on here. Um, they're an organization similar, and just in a nutshell, to the Autism Society, but their focus is a little more on autism and low incidence. And we work with Ocali a lot as a Summit County agency when it comes to education. But Ocali is a wonderful place with questions. They do a lot with technology. So I would look them up on a website. Is there? Can you speak on CARES Act and when these services might pause or end? I don't know. I know the first round of CARES Act money that went out to our community action councils went very quickly. If you remember in the beginning of the pandemic, a lot of people were struggling with rent. A lot of people were losing their jobs, getting laid off. And that first round, I think it lasted until February of this year. And then there was another round that went to community action. As far as I know, that is still open, but you do have to answer a questionnaire about, did COVID have an effect on your living situation now and why you're behind on rent? But I don't know how long that money will last or if there'll be another round that comes out specifically earmarked for rental assistance. Is there a symbol-based questionnaire? Wendy, maybe you can speak to that.
I'm not sure to what it refers. Is it to like our post survey? Is it a questionnaire for a housing app? I'm not quite sure what you're referring to, if you could be more explicit.
If the wait list is so long, where do those individuals stay while waiting? Well, so they're typically where they currently are. And I'm assuming that you are speaking to the housing authority, like a voucher wait list. When we run into people who are in that and on a wait list for a voucher or project-based, we try to find other community organizations that might be able to help them with assistance in the meantime. But again, if it becomes, to where the person is, we've had people we've connected to housing authorities that are more or less couch surfing in between places. And then that's when you move into the space of being, rent burdened or risk of homelessness, which do move you up on the waiting list. But if somebody's just kind of making it on their own, they'll stay where they're at until they're able to get moved up on that wait list.
So that symbol support individual questionnaire is about where they want to live and people, places, and supports that they need. For maybe the disabled that otherwise wouldn't understand, is what I'm thinking.
Mm-hmm. I can suggest for people who want more information, and I'll send this to Wendy too. Again, please remember the counties are different from county to county. Every county is its own little continent, just like every school district is its own separate place. But Hamilton County Board has a really nice resource for housing. And they do speak very generally about housing options. And going back to the question about, parents getting together and buying a home, there's actually a piece on the Hamilton County Board website that talks about that. So I can share that website with all of you that attended tonight through Wendy. It's just nice to gather information. The only caveat again is it's Hamilton County. So when they talk about services that they offer, remember that's the Cincinnati area. But it does walk through just some of these different things and, questions about, does it affect my Social Security, or trust? If a family leaves a house in trust to an individual, it does speak to that. So it's just a really nice overview of some housing options. Let me write that down too. Housing for DODD in Hamilton County.
So when we received an entire list of all the questions from all of you out there about what you wanted to see in a webinar, and now you understand why we sent out that little disclaimer later, because you crawl into a spider hole when you try to take this umbrella topic of housing and then piece it apart. We're going to be offering webinars that do that piecing apart and tease out the different formalities, I guess, of what housing looks like to different families.
Well, and with housing, there's a lot of different working parts, as there are for all of us when it comes to housing. But, on top of that, you have guardianship, and how does that interrelate to housing? But I really wanted to get across today, and I hope that, when you talk about services versus that physical structure of housing, it's two very different things. And it's completely up to the first person to find that home or apartment or whatever. And then it's our job, at least the way I view it as a county board, to make that happen for you. So what supports do we need to make you successful in where you choose to live and where you want to be? And that's our job, to put those supports together.
Are there any other questions?
Vocation. Oh, okay. So you're speaking to when it comes to symbol-based questionnaires in the unique curriculum. I'm familiar with that. So I can look for, would it be helpful when it comes to housing and things like that? I can ask my counterparts at Summit County in our inclusion department if they would have anything and include that. And are you just talking specific to housing symbols, or anything else that I could hopefully connect you to? Okay. So just housing. I'll see what I can find and send that to Wendy, and we can include that in the resources. I'll talk to our inclusion department. Are there any other questions? All right. I know it's a lot of information. And
well, Jackie, we want to thank you very much. It was very organized. It was very insightful. It probably created a lot of questions.
I'm sure it did.
And that's okay. I mean, because demand the answers to these questions. But just know that the Autism Society will be on top of this and start to piece apart more webinars on this topic, as well as medical care, employment, and funding streams for kiddos who are going into adult life. So thank you very much for attending, and look, tomorrow I'll be posting everything on our website. Thank you.
Thank you. Thank you.
Bye. Thank you.
Bye.